Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays on the Dr. Diane Show, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, spirituality, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And please like and subscribe to my channel, Dr. Diane Hayden. I'm excited today to have Sandra Enders with me. She is a licensed psychotherapist in Connecticut with a specialty license in addiction studies. She is no stranger to complex trauma and substance use disorder and adheres to a self-medicating the trauma explanation for it. She believes it isn't the trauma itself, but the lack of support or emotional availability present at the time. Sandy teaches her clients more about identifying their early childhood traumas than she does about identifying today's triggers, although both are important. She believes that the opposite of addiction is not sobriety. The opposite of addiction is human connection, empathy, and compassion. Favoring a harm reduction approach to treatment, she uses alternative methods to mental health, such as spirituality, integration therapy, finding purpose in life, and raising vibrational energy levels. Once a higher dimension is achieved, high-risk behavior falls away naturally. And you can learn more about her at www.sandraenders.net. So welcome, Sandy. How are you today?
Hi, thank you for having me, Diane. I'm flattered that you asked me.
Oh, of
I
course.
watch you on LinkedIn a lot. I mean, you're really doing well. I noticed you a few months ago, and yeah, I was flattered when you put it out there. And I said, well, I'm getting a new book out. Maybe she'll want to have me. Thank you.
Yeah, of course, of course. So we're going to talk all about that. But I like to kind of get into a little bit about you and who you are, and kind of your journey um, into doing what you do. Basically, your bio said a lot about trauma and things like that. And so I think it's funny. Most holistic practitioners that I work with or interview have had some type of situation in their life, some crisis or trauma, or the journey that led them to doing what they do now. And
Yeah.
so tell us a little bit about that.
Yeah, that's just me. I mean, I have a passion for it. I always have. And it was definitely from my childhood. It was complex trauma, very dysfunctional, chaotic, conflict, no serious addictions, but except food. I came from an Italian family, so everything was food, food, food.
Right? You can't get away
And
from it.
oh, you can't. So that's kind of started it at 6. My mother had to work full time. I was really on my own. I was like a feral child. Thank God we lived in a good neighborhood with good neighbors. But it was, a lot of family around, but nobody emotionally available. Back then in the 60s and 70s, there was no such thing as emotional availability.
Nope. You didn't
Pissies
talk
were
about
around.
anything.
Yeah. Yeah, really, everything was hidden, and they would just, if you brought something up, it was just cut you down. You're not supposed to talk about it, especially if it's abuse in the family. And that led me to, binge eating disorder through my childhood, which led me to um, pills and a pothead during high school, which led me to stimulants in my early 20s, which led me to have a mental breakdown by the time I was in my mid 20s with crystal meth. So then I put myself into therapy with a Yale PhD, fantastic woman. And this was going back like 30, 40 years. So I was very lucky I hooked up with her. I think she was still in grad school. And she turned my life around. And from then on, I knew this is going to be it. My long-term goal was going to be this. And I always studied self-help, even through my teen years, because I had nobody to help me. So I had to buy books to figure out what to do. And so I was always into self-help and psychology. I studied a lot about human behavior through the years. And my mother was very spiritually inclined, not well educated, but very spiritually inclined. So she kind of led me into the metaphysical world. We grew up very Catholic, and I kind of drifted from that I kind of went in and out of it. I got into New Age in my 20s. That was during the 80s when it was first coming out. So I got heavy into New Age when I was going through my recovery. And I loved it. So I kind of mixed Christianity with a lot of New Age. In the past 10 years, I I started to study quantum mechanics, which even went further, with the metaphysics, because I always wondered, how do you connect? Like I always couldn't figure it out, but I knew that it worked because I just had this idea that the Homo sapien would have gotten rid of that prayer and praying to the gods through evolution. I just felt like that. I taught sociology 20 years and I know how culture develops. And I just knew it in my head that there had to be something to it. So that's what really brought me on the road to studying quantum mechanics. And what this new book does is it actually connects the dots of Jesus's words, because I could never figure out his words. How does it connect with there? How do you connect with God? Through his words. He was always about humility, forgiveness, this and that, more social interaction with how you treat your neighbor. But he never really talked metaphysics straight out about how you connect with the higher powers. So that always intrigued me. And I never did figure it out until I started to study the Sermon on the Mount this year, because I wanted to do this book on it. And I really started to study it. And when you do, you realize that the way he directs you, a lot of people might think that he makes you be a doormat for other people, but it's not like that. It's the energy you put out in the universe. I studied David Hawkins a lot. I don't know if you've heard of David Hawkins. He does the levels of consciousness. He's a British neon psychiatrist, and I think he also had a Ph.D. in theology. And he's got a ton of books out on levels of consciousness. So I've been studying his levels of consciousness, and he goes through just the feelings and the emotions, not only that, the thoughts too, that you send out there is going to be what comes back to you. That whole study of manifestation, the
Law of
secret,
attraction.
yeah, law of attraction. And so many people say it works, but I wanted to figure out how it works. And
Right.
this man, David
That's the
Hawkins,
mystery.
yes, this man, David Hawkins, I think he just died over the last 10 years. It's very complex, but he has about 10 or 12 books out on it. And well, you might understand how he measured it through kinesiology methods of the muscles, something like that. Because don't
Like
you have a
muscle
background
testing.
in? Yeah, muscle testing. And he came up with a grid of nine, I think he did 9 dimensions, about rising up, how you rise up with 9 dimensions and what types of emotions are really bad. He puts them on the lower rungs. What type of emotions are really good? For instance, shame is the lowest emotion you could put out there, which I found unusual, even lower than hatred. And I've heard that from other metaphysician type of people, that shame is really the worst one. So then he goes into different levels. I wish I had a level thing here, but it's online. Um, and that really started to really intrigue me I just found him about maybe 4 years ago. So he's kind of new. He's in my current studies. But I've been watching Gaia for years, the Gaia TV. I'm very big into that.
Yep, love
So,
Gaia.
but I'm still Christian. I love Jesus. I never even left the church as much as I hate some of the things they did through the years. They've also done good things. I just never had the heart to leave them. It's just something you grow up with, the stained glass windows and the ceremonial candles burning and everything. I never really left them. And I knew his words were fantastic because his philosophy spread throughout the whole world, and it's still throughout the whole world. Um, but I just never really connected it with, you know, how do you connect? And the Catholic Church, of course, never wanted you to know how, because they kept everything undercover the way the top,
That's a whole nother
1%
podcast.
does. Locked away in their Vatican vaults.
Right.
Um, and they had their mystical branches. I'm not saying they didn't. They had their mystical saints and they wrote a lot of books, but you couldn't understand them from a metaphysical view because they were so out there.
Right.
The mystics, the Catholic mystics, like Merton and Saint Teresa, they had them, but I never really understood it from a metaphysical view. How do you connect? Until I started with Gaia TV and studying, some of the quantum mechanics, just how it really works. Well, it's a theory still, but if you believe that there is a higher powers, um, rather than materialism, you got to believe in the levels of existence in human nature. I think that was Thomas Aquinas's 5 defenses for the existence of God, grades of perfection in human nature. So, I used to
This
study
is all.
Thomas
This is all
Aquinas.
awesome, awesome information. Really, really fascinating. We're gonna have to go to a quick break, but we're gonna
Okay.
talk more about how you're blending the spirituality and the
Yeah.
psychology. I love it. So you're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're gonna take a quick break. When we come back, we will explore more with Sandy Enders. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. And before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my 2 publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Sandy Enders at her website, which is www.sandraenders.net. That's spelled SANDRAENDERS.net. So we were really getting into your philosophy of spirituality and how that meets psychology, and just talking a lot about interpreting Catholicism and the words and the teachings and all of that, which I think I love it because I think there's a lot of people who are, I don't know if confused is the right word, but maybe just shy away from it because they don't really understand the teachings and the wording and the words that they use in the Bible. It's kind of this really sort of almost like old time kind of
like mythology.
philosophical. Yeah, exactly. And people
Yeah.
can't like relate to that in present
Yeah.
day so much. So I want to talk more about you specifically as a practitioner and what it's like for for someone to work with you. Like, what is your approach for treating the problem of addiction? If somebody came to you, what's it like to work with you?
Well, I was in a residential for 4 years in New Haven at Retreat Behavioral. They closed last summer. So I haven't been doing that much with addiction, but I learned a lot there and I would teach classes there it was great 4 years. I was sorry that they closed because I loved the job. But that's why I got into my practice heavier now because I lost that job last summer. But I I follow definitely I follow Gaber Mate and Bessel van der Kolk with the body mind together, definitely. And Gaber Mate is one of my favorites.
Me too. I love his
He,
books. He's
yeah,
fantastic.
yeah.
I
Because,
know someone who's actually gone to his retreats, like has
oh,
worked with him
really?
live, which she said was
Yeah,
absolutely amazing.
yeah. He's probably one of my favorites currently. Um, and I love how he put it together that it's not so much about first of all, he put it together that trauma causes self medication. And I think that was huge. Not every time, because, I got a lot of people that argued with me. Well, I had a good childhood and I still had an addiction problem. It's every time. But I think the bulk of the times people are self medicating a pain they have, whether it's the physical pain with opiates or a psychological pain.
Yeah.
Yeah, I mean, it just makes sense. It just makes sense. And I know that's what I did early on. At 6 years old, I started the binge eating, self-medicating with my mother's drug of choice, bread and pasta.
Mhm.
It's just you learn that so young and it calmed me down. I'd be alone in the house in the morning and after school, and I was afraid being alone at that young of an age, and I'd self-medicate on that. 14, I started with self-medicating on the pot, but I know a lot of it was because of the early complex trauma that I had just being on my own so much. And because I was on my own so much, I kind of worked into one of them what do they call it? Parentification, where you become the parent. Um, yeah, because after my father died, I was 30 years old. I was with my mother the next 27 years. She moved in with us the last 17 years of her life. I mean, I loved her dearly. And she had a lot worse childhood than I had. So I understood why it was the way it was. But she got to process her stuff later in life when she was living with me. And I'll tell you, Diane, she bloomed. She just bloomed in her last 15 years, last 20 years, because she was able to process it with somebody who knew about it, knew about trauma. Um, but I definitely, that caught my attention with Gaber Mate about, it coming from self-medication. I always kind of liked that theory the best when I studied the addiction theories, but also his work on intergenerational trauma, I love. I don't know if you know his work on
I do. Yeah.
intergenerational trauma, because he was born during the Nazi occupation in Budapest, Hungary. His mother was traumatized, and he was traumatized as an infant. So he talks a lot about that intergenerational trauma, which I really believe in. I mean, I adopted a baby from Guatemala, and the woman came of age. The birth mother came of age during the Civil War in the Western Highlands of Guatemala, where it was being fought. And I know that's what kept my son in the beginning having problems. He had a speech delay. He got through it all, but it was tough. But I'd swear it was because of what the
Yeah,
woman had lived.
it's
Yeah,
really fascinating. It goes back even further than that.
it
Like your
does.
grandmother or your great grandparents
Yeah,
could have experienced some trauma, and
yeah,
that's stored in their DNA, and now
yeah,
that gets passed down to
yeah,
to your mother and then to you and to your kids, and you don't even
yeah,
have to have had any like live trauma in your lifetime, but because that DNA has been passed to you,
yes,
you're you can, I'm not going to say this is the case for everybody, but you can be set up to be more, be somebody who is more apt to have an addiction or
Yeah.
things like that just because you have this trauma in your DNA. It's
Yeah,
really
it makes you
fascinating
more
to study.
vulnerable. Yeah,
Yeah,
it makes you
yeah.
more vulnerable. But take it one step further, Diane. I don't know if you ever thought about this. We're in the Western world, the Eastern world believes in reincarnation. So just put that in your head.
Yep, yep,
Does it get passed down? We don't know about reincarnation. Does it get passed down for a lot of generations? They say
exactly.
the psychologists usually say 3 generations it'll go back. But I don't know when you think about the reincarnation that the Eastern world believed in all them years. And some people believe Jesus even came from that school of thought with the Essenes. I don't know. It's hard to say. I don't know my position on that reincarnation, but it gives you a food for thought about, if it does get passed down in the spirit.
Right.
So, yeah, so Gabriel Mate, who else are my favorites? Joe Dispenza, I love. Do you
No,
ever see him?
I've been to 2 of his retreats.
Oh,
I
God,
have written
he's
articles about him.
fantastic.
He's amazing. Yeah.
Yeah, I
Yeah,
used
that's
to
a
show
quite an
him.
experience. If
Yeah.
anybody gets a chance to go, I would absolutely go to a Joe Dispenza retreat. I mean, it's
Really? You
just
went to one of
unbelievable.
them? Yeah.
2 of them.
Wow.
Yeah, I went to 2.
Yeah,
So yeah,
he's
he's
um he's
amazing.
into rewiring the brain, and I used
Right.
to teach a lot of that at retreat. How he's got that 13, that series of 13. I went through about 6 times.
Well,
Um,
speaking of
mo-
rewiring the brain, that's one of the questions I wanted to ask you about. We've got a couple minutes before we go to break, but we can start now and pick up if we don't finish it. You have experience with psychedelic assisted integration therapy, which
yes,
one of that or that is like the more common name people might understand is ketamine.
yeah. I
So
I
tell
work with
us,
Ked. I could
yeah,
work
tell
with
tell
ketamine.
us how you feel about that because I know there's a lot of controversy around
Yeah,
it. But so I'm curious, like, what are your thoughts about it? Why do you like to use that?
because it works.
Okay,
um, and
simple as
the
that.
I think so. And the talk therapy just goes so far. I mean, the biggest thing we have right now, aside from psychedelics, the most successful therapy for past trauma is the EMDR, the eye movement reprocessing, desensitization reprocessing. You're probably familiar with that, where you
Yep,
move the eyes back and forth.
right.
um it might work for some people. I never became certified in it, but I've studied it a lot and tried it out with some of the clients, and it's difficult to get rid of trauma with these talk therapies. Also, the other therapy that they use for phobias a lot, exposure therapy. I mean, they're good therapies. Those are like 2 top ones. But when you take some of the psychedelics, it increases plasticity in the brain while you're taking, but also about a week or 2 after. It makes your brain more malleable, so you're able to change habits easier. Not only that, I found that it just takes you on a higher level of energy. It did for me. I had about 6 or 8 sessions with my therapist from Westbrook, Joanna, over the past couple of years. And you know what it did for me? I didn't really have a big problem anymore because I know how to manage my depression, but it increased my confidence, Diane, like you couldn't imagine. You know, that's what made me go into the practice. Now go into the group practice, get another book out. It just increased my confidence so much. All of those old hanging, limiting beliefs that you have in you for years and years, they just like disappeared. And all of a sudden, the past year or two, I have a lot more confidence than I ever did. I don't know why. That's the only thing I could think of, Diane, because nothing else happened in my life that
Right.
would suddenly give me a boost of confidence that I'm doing these type of things, coming out with a new book. I just had the
Well,
2 websites done
yeah,
over, and it's like I don't have the fear anymore. Normally, I would have all this fear. Oh, spending money on this website and that, or
No,
maybe I shouldn't. It was all like
it's rewiring the
fear-based.
brain. It's totally
Yeah.
rewiring the brain. We're going to take another short break. You're listening to
Okay.
Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Sandra Enders. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I'm talking today with Sandy Enders. You can learn more about her at www.sandraenders.net. That's spelled SANDRAENDERS.net. So I want to make sure we talk about your new book. You've mentioned it like a couple times as we've been talking, throughout the show today. But what is the name of your new book? When will it be out? And let's talk a little bit about the theme and just the impetus for you to write that.
Yeah. Well, the name of it is Blessed Are the Broken. The tagline, I'm not positive, recovery and transformation, or recovery and redemption. I might do recovery, redemption, and transformation through the Sermon on the Mount. But it's called Blessed Are the Broken. I don't know. I kind of liked it. I didn't know if that was too negative at the beginning, but I kind of liked it.
I like it.
And it goes through the Sermon on the Mount from Matthew 5, 6, and 7, the Beatitudes, blessed are the weak, and, blessed are the, I don't know, 8 Beatitudes in the beginning. So the first 8 chapters, I got 12 chapters. The first 8 chapters are on each of the Beatitudes. And then I do 4 other things from Matthew later on in the Sermon on the Mount. But when I started to study it, I realized it was one of the major sermons throughout history, that a lot of people think it was one of the greatest sermons throughout history. And I really started to get into it. And
let me just back up for a second. What
yeah.
made you think to write a book about that? Did you have like some download, or like what was the impetus for that? What made you even think like, oh, I should, people need to know about this. It affected me in a certain way, and I want to talk about it.
Well, I got 2 other books out. One was on the Rosary, the 20 events in Christ's life. I got it right here. This was one of my first ones. It was guided imagery scripts on the 20 events in Christ's life. And then I moved to meditations on the Pentateuch, the first 5 books in the Bible, the Torah. And I wanted to do something that got into psychology and spirituality this time. I didn't want to because that was just really strictly Christian spirituality. So this time, I got so many years of education, and with psychology, I wanted to move to something more that included some teachings of psychology mixed with the spirituality. And I just came across his Sermon on the Mount. And I said, well, this is kind of interesting. And, I started it maybe about a year and a half ago studying it. And then it's about the past 6 months that I realized the connection between his words and David Hawkins, the levels of consciousness that are being studied a lot now with the metaphysicians. And I knew that the emotions and the thoughts you send out there were important because of the law of attraction, and all the people who studied that. Lynn Taggart, you know her? She came out with that book, The Field, Lynn Taggart.
I love that book. I read that a long time ago. That was wild.
Yeah. So I'm thinking, wow, because when you read it just as a reading, it sounds like he wants you to be a doormat for everybody. It really does. And then I said, no, there's got to be something more to this. There has to be. And then I'm thinking, 2,000 years ago, we weren't ready for metaphysics and, quantum mechanics. Maybe Aristotle's metaphysics and Plato's, but not quantum mechanics with Einstein and these new ones that came in over the past 100 years. So I'm thinking Jesus wanted to bring his word here, and on a social level, which he did fine. I mean, it went all over the world. But I think that a deeper look into it might have been the metaphysical things he was trying to get across. And then there's some people that really believe that he was Gnostic, um, and was in with the Essenes, and that the Catholic Church changed a lot of his words around in the third century to keep us, under control, which, I mean, that's pretty well established. Not only could they collect the indulgences, they collect the taxes. I mean, that went on for centuries. So I'm thinking maybe the time is right to make the connection. And I actually found a book, even with Gaia. I mean, Regina Meredith, I love her. I watch her all the time. And she has a lot of people on writing all these books, but nobody ever really connected Christian thought with it. So I just said, well, I'm going to try it. And the worst it could be, it doesn't go anywhere, but I want to get it out there. I just feel like it's something to say. And, one of the higher ups might get wind of it from Gaia. I might put it through Hay House, though. I don't think I'm going to put it through a Christian publisher because I got a lot of that stuff in it. The 12 chapters, I don't. The 12 chapters, I have Christian philosophy, but I got about 30 pages between the preface, the ending, and introduction that talks about my philosophy, and it's new age. So I don't even think I'm going to try and get in a Christian publisher. I think I'm going to go straight to Hay House. And if they take me in, I'm going with it.
Who do you who you're trying to reach with the book? Like who do you think is the target market that would be most impacted by it?
Well, ideally, I'd love to talk with Regina Meredith on Gaia. I mean, I think if she put it out there, I think it could get out there with that mix of the Gaia people that are trying to get the word out, but it's just hasn't been organized yet, and the universities aren't touching it yet. Some of them are. There's some universities that are really getting into the paranormal. Virginia University started it. There's a few institutes that are studying the paranormal formally. But that would probably be my first choice. But I think Hay House could get it out there where I wanted to go. And I talked to them about 6 months ago about it. And I think I might have a chance to get it in Hay House. Louise Hayes company.
Is it more
I think that would be the best place for it, Diane. What do you think?
Well, is it more for people who have had trauma or addiction, or really it's more of anyone who just wants to learn more about the intersection of spirituality and psychology? And
yeah,
okay.
Well, I'm thinking it could go into about 4 genres: spirituality, Christian thought, psychology, self-help, and addiction. Addiction got its own separate genre now. I mean, that's 5 genres that it could go into. And I don't think I'm spreading it too thin. I think it's just the type of book that hits all those genres. The inquisitive mind that has been through so much rehab, like a revolving door over and over. The people that I've seen, it's horrible, especially with the alcohol. It's just, it's terrible. And those type of people that think there's nothing left for them, I think, they might connect with it. But I think they are going places with the psychedelics. Especially with the VA. The VA just got approval, I think, to use psilocybin. So I think eventually that might break into the treating trauma too. But right now it's immediate. People they're struggling.
And there's a great documentary out. I refer to it as a documentary. Is it Michael Pollan who produced that documentary on, and he looked at all like 4 psilocybin, ketamine, I forget what the other 2 were, but it was all basically psychedelic therapy and how it was helping people who had trauma or phobias or
yes,
PTSD, addiction, all of that, and just
Mm.
the how it was changing people's lives by even
Yeah.
just doing one treatment. Actually, some of the people that he interviewed in this documentary literally had
Yeah.
one treatment of ketamine, and they're completely, they're
Mm. Yeah.
completely, addiction is completely gone, the trauma is gone. I mean, it's pretty amazing. I'm not saying that that happens for everybody, but
Mm. And a lot of
yeah,
people are going out of the country because we can't get it here.
right.
They're going out of the country
Yep.
and they're pricey, them retreats. My therapist does retreats. She was in Mexico last week doing a retreat, and she's going to Montego Bay in October to do a retreat. They're too pricey for me right now. But that was How to Change Your Mind, the 4 parts documentary, How to Change Your Mind, I
Right.
think, the one you
Yep.
were just talking
I
about.
think
Yeah.
it's a great documentary for people who need, want to investigate this. They're not sure, maybe it makes them fearful or whatever. Like they're not sure what ketamine is or what, some of these other psychedelic treatments
Mm.
are. He really did a great job as far as explaining in detail, like each of the different methods, and then kind of walking through it with the patient. And he's tried them all himself. So
Oh, yeah. Yeah.
it was really fascinating for me, and I thought, for I was somebody who didn't really know a lot about it, and had some concerns or whatever, and I was like, oh wow, this really opened my mind as far as the safety, how well it's done in medically supervised facilities and things like that, and just the great responses that people are having
Yeah.
from it.
Well, before the war on drugs, they were using it a lot, especially LSD with alcohol in the 30s, 40s, and 50s and 60s. And then they put the kibosh because of the hippie movement.
Yep.
That's what screwed it up. But LSD was working very good with alcohol addiction, very good. And the war on drugs, it's all political. But now with Kennedy, and I think he's going to probably make some changes because he's for it, or at least investigating it, researching it more.
Exactly.
If
Yep.
Yeah, and if it's under clinical supervision, I don't see anything wrong with it. Personally, I think the weed should have been under clinical supervision, but they didn't. I think that should have been something that they should have made, under clinical supervision. But the ketamine isn't exactly listed as a psychedelic. It's actually a um, anesthetic. It's a dissociative anesthetic, but it has psychedelic characteristics. So it kind of gets lumped in
Yep.
with psychedelics, but it really isn't. But now I think they're coming out with MDMA. Um, they're doing heavy research with that. I think that was what the VA reported this week, that they're going to
Yeah.
be they got
All
approved for, and that's
all pretty amazing stuff. So
yeah,
we're
that's
gonna have to take
ecstasy,
another quick
right?
break. You're listening to the Dr. Diane
Okay.
Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Sandy Enders. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Sandy Enders, and you can learn more about her at her website, which is www.sandraenders.net. That's spelled SANDRAENDERS.net. So right before we just took this quick break, we were talking about ketamine therapy. You're saying, repeat that again, because you were saying, I refer to it as psychedelic, which is not technically that.
Oh,
It
yeah.
is,
Ketamine is a dissociative anesthetic. It's used for
okay,
surgery. That's
right.
what it is used for,
Yep.
mainly. But it has characteristics of psychedelics, so it kind of gets lumped with psychedelics. But now we're on the horizon of MDMA, which the VA just went through this week, approved of something going on with the MDMA, which is ecstasy, isn't it?
Mhm.
MDMA
Yep.
is the
Yep.
ecstasy. So they're going to start. I never tried ecstasy, so I can't really talk on it. I was never into the psychedelics back in the day. I was always into um, stimulants. I never really did it back in the day, but I really liked the ketamine that I tried over the past year or two. Also, psilocybin, the mushroom. is coming around. They decriminalized that last year in Connecticut. So I think, and they're studying it in Connecticut. I think that'll be coming out in a clinical setting over the next year or two. And Massachusetts is big on that, and New York. So I think the 3 states, because they already got 3 states with psilocybin clinics.
Yep. So you say in your bio, the opposite of addiction is not sobriety, it's human connection, empathy, and compassion. And once a higher dimension is achieved, this high risk behavior falls away naturally. So for people who have an addiction, or even I think it could be, nowadays people, there's a lot of people I think that, smoke pot, drink alcohol, but don't consider themselves to have an addiction, but yet they're probably doing it every weekend, right?
Yeah.
Or maybe 3 or 4 times a week, or maybe even every night, but
Even
it might
every
just
night,
be
yeah.
1 or 2 glasses of wine or whatever.
Yeah. Yeah.
Why do you feel that when a higher dimension is achieved, this behavior kind of falls away? What happens to the person?
Well, I'm comparing it to the harm reduction versus the complete abstinence. The complete abstinence program was more of the 12-step versus harm reduction. You go down a little at a time and you don't beat the person up if they go off. The 12-step program, traditionally, I'm not saying all the groups, but traditionally, they were pretty hard with the tough love stuff. And they would chastise you if you went off. You had to start at the bottom. And that's why I never really got into the 12-step program. I mean, I got into it to learn it. I wrote a big paper on it years ago. But that's the big reason why I never took to it, because of that chastisement. Plus, a lot of the groups are still saying, hi, I'm Sandy and I'm a drug addict. Hi, I'm Tom and I'm an alcoholic. To me, don't put that out in the universe.
Right.
You know what?
Yeah.
I would
Yeah.
never put, because I was doing crystal meth 40 years ago. That doesn't mean I'm a drug addict today.
Exactly.
I would never tell a client to put that out there. Never.
Right. Because that
Because you
energy
have,
will be attracted back.
I mean, that's manifestation. So those 2 reasons, I just don't understand that 12-step. But where were we going with?
So
Oh,
I was
about
saying
versus harm
harm
reduction.
reduction. Yeah. Explain that a
Yeah.
little bit.
So I think that, if you follow the rules and not the rules, you learn about all your skills, you're supposed to learn about all your triggers, you do therapy, you do this, you do that, you do group, they're all different bricks in the wall. And I think you eventually get rid of your old environment, because the environment is really what's causing a lot of it when it lingers and lingers and lingers. Either the environment or somebody you're living with is enabling it, a mother or father, a spouse is enabling the behavior. But if you start living a Christian life with Christian values, you're not going to be with those type of people. You're going to end up with Christian people, and they don't do that kind of stuff. I mean, the Christian people I hang with don't do that kind of stuff. I mean, they might smoke weed. I smoke weed, but they don't do heavy drugs or drink every night. You know what I mean? So I think if you put yourself in the right environment with the right support, and the support around you counts for a lot, you can rise up in level of energy and vibrational level that you don't even want to do those behaviors anymore. That's how I feel. Instead of beating yourself up, because what they do is they go off, they beat themselves up for it. It's called the abstinence violation effect. It's a cognitive thing. As soon as you take that drink, do that line, have that piece of cake, you're off. Because cognitively, you're telling yourself you're nothing but a worthless piece of crap because you went off, and you're too hard on yourself. So if you go off, you go off. Tomorrow you start over again. But you got to stop beating up on yourself. That's a big part of it, beating up on yourself when you do relapse.
Right. Yeah,
Because
I would agree with that. I think that maybe that's even the impetus for people to have more relapses, is because if there's all that like just negative self-talk and
Yeah.
self-abuse almost, honestly, in
Oh,
terms
yeah.
of what you
Yeah.
say to yourself and how you think about yourself. And
Yeah.
so if I think all these negative things, of course that's going to lead me to whatever the addiction is, because then
Yeah.
I can just, not feel anything
Yeah.
and be numb about
Yeah. Self-sabotage too is a big one. Unconsciously, you self-sabotage yourself because you don't, and everybody around you, they knew you had a problem and they treat you differently. You got to get away from them type of people. Um, you got to stay with people that have empathy and compassion for that, because the stigma in society is terrible, Diane. Not only with drug abuse, they get it the worst, the addiction people, but in mental health in general, the stigma is terrible. When I went into therapy 40 years ago, my family didn't even talk to me. Even my own mother never even asked me, what is the diagnosis you're being treated for? I was in my 20s. It was binge eating disorder. Nobody even knew what that was in
right.
the 80s, and because she didn't want to go there, she didn't want to hear it. They just run away from it. My family did. They just run and hide from it. They can't look at it in the face. I don't know why, but a lot of families are like that, Diane. The stigma in society hurts the person struggling with mental illness and especially addiction. And it's too bad, because it's just the same if you have a kidney problem, if you have cancer, if you broke your leg,
Yep.
than it is if you have a behavioral problem or a mind problem or a brain problem. It's just as bad. You're still got an illness, something you need to control. And I think it's terrible how it's been treated through the years. And I don't mean to bring the church back into it, but I think a lot of the Inquisitions was over empathic healers, that they were afraid of. The church was afraid of those type of women, because who were all the witches during the Inquisition? They were the social workers, the female doctors. They were
The witch doctors.
what the
The witch doctors. Yeah.
yeah, I mean,
Like
they were all
literally.
the people working with all these herbs and everything before medication
Exactly.
even came around.
Yep.
And they were our healers back then. And it just got a bad rap from them. It's the demon, it's the devil. It isn't the demon or the devil. And I think it just never went away because of lack of education.
Yep.
Yeah.
Well, this has been totally fascinating. We are out of time, but I want to make sure people can find you and your new book that's coming out. Your website again is sandraenders.net. And any idea when the book's supposed to come out?
Hopefully by the end of the year. It's done,
Awesome.
but I'm just fine tuning
Yeah,
it.
publishing all
And
that.
I got to, find the publisher where I'm going to put it. So
Yep.
hopefully
Yeah.
by the end of the year.
Well, that's great. People can find you at your website, sandraenders.net, learn more about when the book is coming out, and learn more about
Yeah.
you and your practice. So I want to thank you so much for being with us
You're
today.
welcome.
This was great, an awesome discussion,
Thank
fascinating.
you.
And yeah,
Thank you
thank you
for
for your
having
work.
me,
Of
Diane. I
course. And I
really
want to,
appreciate it.
oh, you're welcome. I want to thank you all for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific, where I have experts from around the country teaching you cutting edge therapies on longevity medicine, natural health, mindset, and soul purpose. Please like and subscribe to my channel, Dr. Diane Hayden. Hope you guys all have a great week. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.